International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hi, my name is David Duong. I am currently a medical doctor and the Deputy Director of the Program in Global Primary Care at Harvard Medical School. I want to use this opportunity to share with you a study that was just recently published that my team and I completed in Vietnam, where we looked at the non-communicable disease service availability, utilization, and readiness at 89 primary care sites in northern Vietnam. Historically, Vietnam's network of primary care sites has implemented acute infectious disease programs as well as national vertical disease programs such as tuberculosis, malaria, and vaccination programs. However, the epidemiology in the Vietnam health context is rapidly changing from communicable disease to non-communicable diseases. So our study wanted to find out if these primary care sites are able to deal with this epidemiological change. From January 2014 until April of 2014, my team and I conducted a study at 89 primary care sites in Vietnam in order to address this question. This was a cross-sectional study where we used mail-in surveys, specifically using an adapted tool from the World Health Organization called the Sahar tool, which is a tool that assesses service readiness and availability for non-communicable diseases. We mailed this tool to 89 commune health centers, and then our team personally went to 16 of those commune health centers to check the validity of the tool and to check the accuracy of the information that was being reported back to us. The results from this study were actually pretty amazing in the sense that it confirmed a very small handful of other studies to indicate that Vietnam in its current state and in their public primary care sites and specifically in rural settings are not ready to meet the non-communicable disease epidemic. We found that aside from mental health services, less than 25% of Vietnamese commune health centers couldn't adequately have any medications or were adequately equipped to address the non-communicable diseases. We also found that Vietnamese healthcare sites did very little prevention efforts around non-communicable diseases, and most of their prevention was mass media campaigns rather than one-on-one counseling. Of particular note, our study was significant because it focused on a population that in a region in Vietnam, the northern mountainous region, that consists mostly of ethnic minorities, and this region and this population has never been surveyed before, to the best of our knowledge, regarding risk factors and also access to services for non-communicable diseases. We found that despite their lifestyle risk factors, such as diet and smoking and alcohol consumption being much higher than the population in other areas of the country where we studied, their access to these non-communicable disease services was much more lower. In conclusion, what our study found was that this was the first multi-site study regarding non-communicable diseases in Vietnam. It's also the first study to look at a very marginalized population, this being ethnic minority population in the northern mountainous region. Despite the government of Vietnam's extreme and good political will towards wanting to control non-communicable diseases as set out in the Vietnam National Health Strategy from 2015 to 2021, our study agrees and supports the key findings of other much smaller studies to indicate that currently at this point in time, the Vietnamese health centers are not adequately equipped to address the NCD epidemic. Thank you so much for listening, and I look forward to your comments in the paper.